So, hi everyone, and this is a summary which I have prepared for our webinar because I thought it may be too long for you to get the gist and the essence. So, that's the purpose of recording this. Now, I would like to just give you an overview about importance of heart health for women because it is a very big misconception which is there that heart health is problems or heart attack only happen to men or majority happens to men. So this is something which we'll debunk today. We'll understand what are the specific factors which are applicable to women, and third, we will give you a framework that how you can properly screen yourself to assess and know your risk. Second, we will work on and give you a framework about nutrition and the exercise strategies which you can use. So let's start. So the first thing, as I mentioned, that the heart disease is the leading killer of women, and it's not breast cancer, which is most common conversation when I find when I speak to women. That cancer is rising. Cancer is a disease which is commonly affecting women of especially in their 40s, 50s, 60s. But that's incorrect. If you put together all the different forms of cancer, also then also the number of deaths, number of diseases, people, women who are suffering from heart disease will be more. So just understand heart disease is the leading killer of women, and it's not breast cancer. Now let's understand why is it so. The first reason is that South Asian women face a higher baseline risk versus say a woman of in Western population. Now, in terms of genetic factor, it has been found by different studies that heart disease affects almost 10 years earlier to South Asian women versus their counterparts outside. So this means that you already have a genetic predisposition or a relative higher risk which you are carrying for a heart disease. Now, what that genetic predisposition means that the plaque formation would be faster, the probability of event is more. So that's what it means, and you need to keep that in your mind. Now, second aspect is women heart are different. Their physiology is different. The size is different, and what has been found is that some of the specific conditions, like heart attack, is still the one of the most common manifestation of a heart disease. But then there are certain specific diseases, what we call as a supply-demand mismatch, which is most common non-atherogenic mechanism in women. What it simply means is, what is a heart attack? Heart attack simply means that heart is supplying blood to itself, and in that supply, if there is any disruption, that leads to a heart attack. But now that's not been found, that that's not the only mechanism which leads to heart attack, but there are some specific issues which happen in women heart. One is the supply demand mismatch, which is one of the most common. Second is that there is some spontaneous event which happens. So it is 5 times more common in women. 1 in 10 heart attacks in women under 65 is due to this thing. So this is the second thing. And then microvascular disease. What it simply means is that the smaller vessels which are there, the smaller arteries, they pose a risk which may not get caught up in some of the other disease. So that means there is a nature, in terms of nature of the kind of conditions. Still most common remains a heart related or a plaque related formation, but there are certain type of events which happen specifically or more frequently in women. Now let's understand menopause. So menopause is a natural event which happened in middle age, in the 40s or the 50s, and it's again a misconception that menopause cause heart disease, or because why this myth prevails is because post menopause the risk of heart disease increase. Let me explain why it happens. It is happening because the estrogen production as you reach your perimenopause stage, it starts to reduce. Now it happens over a period of 2, 3, 4, 5 years, depending upon your perimenopause duration. But it will happen in every case. Now, a very important function of estrogen is that it helps maintain the blood vessels. It also means the plaque formation and everything. It is more controlled due to presence of that hormone, and it also reduces inflammation. Maybe that design was part of the reproductive age where the more extra protection is required. That's how probably it is part of the woman body and hormone design. But when it declines, these protective effects fade. So it's not that it is the menopause is the cause. It's just that you had that extra shield, extra protection. Now that goes away. That's why the risk increases. Now, other aspect I want to highlight is that women heart attack symptoms are different. Uh, a very common image when it comes to heart disease is that someone is holding a chest and then experiencing a heart event. Now, surprising fact is that 30%, that means almost 1 in 3 women, do not even experience a chest pain during a heart attack. So, what are some of the common signs which have been found? Jaw and neck pain, especially on the left side, constant fatigue, nausea, back pain, shortness of breath, sleep disturbance. Now, if the combination or sudden onset of some of these symptoms, they may be an indicator that there is a severely compromised condition, or a mild heart attack may be happening. So please do not ignore if these symptoms were not natural to you and they've suddenly appeared, and do not ignore them as anxiety or a stress or just tiredness. If it is happening persistently, or if it starts to happen suddenly, please immediately go and visit your doctor, because that's where there is a probability that if the heart event is happening, right action are taken at the right time may mean that you can save your life as well. Now, now we've understood that in overall pattern, the kind of certain types of diseases, the symptoms, and also the fact that the genetic predisposition is there in women, that you need to keep in mind. Now let's understand how we can take care or screen ourselves about a heart risk. Now, you some of you who are listening and watching this video, they may already be undergoing undergoing annual checkups by through their workplace or themselves. Now, that is great, you should get that done, but I want to here emphasize some of the key biomarkers which often get missed in the annual corporate checkups, or sometimes the packages which you buy. Please make sure that some of these tests are included, because heart disease is not just cholesterol. It is cholesterol, inflammation, insulin resistance, and these factors collectively make your risk exponentially high. So what are these four biomarkers which may not regularly get screened? APOB. So as I mentioned, that artery which may get blocked, and where the plaque formation happens, that is where the key issue is. Now, what is that specific marker? The specific marker is usually thought as LDL, which is correct, but the more accurate marker now, as per the latest advancement which we have achieved in the medical science, is APOB. Now, what is APOB? APOB simply means you think of two roads. In one road, there are less number of vehicles, and the other road, there are more smaller vehicles, more number of vehicles. Now, the total load which both these roads are carrying is same, but the road which has more number of vehicles is where there'll be more traffic. So consider that APOB number is indicating that that traffic and that is where why, and the LDL number is indicating the total load which is there on the road. So that's why APOB is the more accurate marker when it comes to if you have building a plaque in your possibility of building plaque in your arteries. So please get that checked. If it is more than 100, that means you are already at a certain level of risk and you should be taking certain action. Now comes the second test, which is called HSCRP, which simply means high sensitivity C-reactive protein. Now, what is HSCRP? HSCRP is measuring inflammation. Just like you have inflammation outside your body, that means if you get a cut or some rashes, the skin gets inflamed. You can say something similar happens inside. If there is a certain immune reaction or infection, then it will cause this number to increase. Now, what does inflammation has to do with a heart condition? Now, in the first thing which I told is the plaque formation. Now, heart attack do not happen just due to plaque formation. The plaque needs to break. That means the clotting needs to happen, and then that blocks the artery. And this process of plaque formation will get accelerated faster if HSCRP number is high. So what it means is that let's take two people have same level of cholesterol, but the person who has higher HSCRP number, higher inflammation inside, will have fast increase, rate of increase of this plaque would be very fast. So that is why inflammation measuring is important. The cutoff for this number is 1. If your number is more than 1, then it means there is inflammation in body. So you are at another risk factor is added. Now comes the third factor, which is fasting insulin. What is fasting insulin? So whenever we eat food, the food is broken down into, you are eating a roti or you are eating a rice. Then it's not that rice and roti directly goes to your cells. There is a process by which the food is broken down into glucose, protein, and fat, and then that different mechanisms that food moves to cells. Now here the important thing is glucose. So what happens is when the glucose is released post digestion in our blood, at that time pancreas, it is one of the very important organs, it releases a hormone which is called insulin. Now, what is insulin? So insulin, consider that your cells can't just take glucose just like that. They need a key, and that key is released by the pancreas. That key goes in and unlocks the cell, and that's how the glucose is able to enter into your body. Now, if that fasting insulin is high, that means is that body is compensating to make sure your blood level remains common. Now, most common test is what is called HbA1c, a blood sugar level test. Now, that number may be normal, say 5.5 or 5.3. But if your fasting insulin is high, that means body is already under stress and it is taking extra load, but it is trying to maintain your blood sugar level by increasing your fasting insulin level. And that is where an action is required for you, because fasting insulin may precede high blood sugar 5, 6, even 10 years earlier. So if that number is higher, that means it is more than 10, that it means that your body is already having insulin resistance, and that is one of the risk factors. Now, the fourth test which we always ask is called Lp(a). What is Lp(a)? As I mentioned, that South Asian women are at higher risk versus the Western population when it comes to heart disease. Now, how do you know that risk is present in you? One of the tests is a blood test which everyone can get it done. You need to only get this test done once, and that is called Lp(a). 1 in 4 women, this number may be likely to be higher. That means more than 30 units. If it is the case, what it means is there is no medicine for it. But if that number is high, that means you as an individual are at much higher risk versus someone who has a normal or below normal that number. So these are the four-way test which gives you more information, more clarity that whether you are at real risk, and these are very much accessible, available test with all the major diagnostic blood companies. So I strongly recommend you get them screened. Now comes, you have understood, let's say you are at risk, maybe menopause, maybe family history, genetic history, and certain blood biomarkers. Now what you can do. So here I'll be sharing a simple framework or simple things which you can do. The first is the nutrition lever. So what is a nutrition lever? In this, you need to remember three most important things in terms of intervention for better heart health. One is fiber. Fiber is very important because it's not only feeding the gut health, but it also been proven to lower your cholesterol level and also stabilize your blood sugar level. So how do you get fiber? You get fiber from three major sources. The first source is your fruits, if you eat them in a raw form. The second is your salads and vegetables. Obviously, salads have higher fiber, and vegetables, by virtue of cooking, some of the fiber is broken, but still an excellent choice. You should be including a good, 3 to 4 servings in a day of fruits and vegetables. That's important. And second is in terms of your whole foods, whole grains. So maybe your unpolished rice, your whole wheat. Some of people may be having millets or quinoa. So all these healthy, grains which have a lot of their fiber intact. So that should be included. Now, second comes the protein. Protein is in India, I have found in coaching so many people all across that we have been under eating protein. Protein is not been is been it's a misconception that it is all about muscle building. Yes, it is one of the subset or one of the functions of protein, but protein is playing a role in all your enzymes. What are enzymes? Enzyme is actually involved in breaking down or digesting your food. So enzyme is what protein makes those enzymes. Your hormone levels, hormones are made in the body through protein synthesis. So that is where it has a role. Then your immune cells, your bones. So protein has multiple effect. There is no test which you can say, at least that you can get done a blood test and say you can say that you are deficient in protein. But if you have constant fatigue, if your weight is increasing, if your strength is going down, if you have frequent immune infection, that if you're severe hormone imbalancing, then do understand that protein has a role in it. So that is a very important thing. You should be having protein not in one meal, 2 meals, but all the meals, and more distributed it is, the better it is. There are plenty of vegetarian and non-vegetarian sources. Depending upon your meal preference, make sure you're having adequate amount of protein. Now, the third nutrient which we emphasize is omega-3. Omega-3 is one of the most important nutrient. It's a type of a fat, a lipid, which is there, and it reduces inflammation, it lowers your triglycerides, and it protects vessels. So it has a lot of importance. What are the sources? The vegetarian sources are in nuts, flaxseed. These are some of the algae, which is one of the sources. And in non-vegetarian, the fish is and to some extent eggs are a source or good source of omega-3. Now, how do you put all this information together in a more practical manner? So I recommend that you follow a plate method. What is a plate method? So a plate method means that let's take, you have a plate, you divide it in 4 portions. In one portion, you should be having your complex carbs, your whole foods, rice, wheat, millets, whatever you are eating. And then the other 1/4 part, you should have some amount of protein. For it could be paneer, it could be tofu, it could be chicken, fish, egg, and beans, and pulses depending upon your preference. That should be the portion of a good portion, and even curd, I would say. A thick curd would be an important source of protein for you. Then the other one fourth comes is your vegetables. So vegetables here I means non-starchy vegetables. So like potato will count under non starchy vegetable. It's a starchy vegetable. So things any seasonal vegetables will be counted as there. Then comes the last portion. There should be a good amount of salad, fresh salad, which is seasonal vegetables, like maybe it may be kheera, it may be carrot, it may be a lot of these types of cabbage, salad leaves. So many options come these days. That you should be tomato in all these forms of salad. So roughly one plate will look like half of them is your vegetables and salad, and other half as protein and carb. So this is, if you follow this in all the 2 or 3 meals you are taking in a day, you make sure that you are meeting these nutrition levels for your health. Now comes the other part, which is the non-nutrition part. Here I would like to emphasize sleep is one of the biggest lifestyle lever. Why I say that before nutrition and even before exercise, sleep comes, because if your quality of sleep is poor, then it affects first your mental health, your emotional health, and third is your physical health. Because a lot of repair function, just consider that if a road repair needs to happen, then the municipality close down that section of road and then they do the repair work. So that repair work happens day after day only in sleep. So if you're not giving adequate sleep to your body, repair will not happen, and that increases a risk of a heart disease. Now, other aspect why liver is important, sleep is important, is because if you have inadequate sleep, in the next morning you will not feel like exercising. So for how many days you will use your willpower to exercise? But if you are well rested, then the probability of going for exercise is higher. So that's why sleep actually induces or affects your ability or your willingness to take up exercise. Second aspect is nutrition. Now the surprising part is that if you have less sleep, then body has not recovered, and suddenly its energy demand increases. So you start craving for fried food, high calorie food, high sugar food. Your dependency to be functional and dependency on stimulants like coffee and tea increase quite dramatically. So now you can understand why sleep is a most important lever, because it is affecting not only your repair and other internal aspect, but also influencing exercise and your making right choices for your nutrition. Now comes the second part, which is exercise. Here I always emphasize that in any exercise program, 3 components should be there. The first component is aerobic fitness component, and the second component is resistance training, and third is the restorative or the relaxation work. Now, when it comes to resistance training, you can take any form of resistance training. You can go to gym, you can do body weight training, you can do with resistance band or very light weights at home. Doing it 15 to 20 minutes, 2 to 3 times in a week is good enough to start with. Then the second aspect is the restorative work. So there, I would say an important intervention is yoga, meditation, yoga nidra. These are some of the very important benefits or tools which you can use for restorative work. Now, one technique which I think majority of people here when I speak, they may be doing walking. So start with this, but don't just stroll, or just don't just think you have to do a brisk walking. So I want to introduce you to interval walking. What is interval walking? Interval walking was also these days known as Japanese walking technique, But what it simply means is interval walking, as the name says, that you have to walk in intervals of doing a fast, as fast as you can. You don't have to run, but you have to walk as fast as you can for say a couple of minutes, and then switch to slow walk, means regular walk, for 2-3 minutes. So you keep switching between fast and slow, and do 3 or 4 rounds. So within the same time, that will simulate your cardiorespiratory system better than just doing a walk or just doing a brisk walk. The details of this technique is being given in the ebook, so where I've broken down exactly how you need to do. Maybe if you're walking or on treadmill, either of the ways it will work. So please check out the ebook, which you can get access to. Now, other last aspect which I would like to emphasize is that when you go for your proper test or to cardiologist for normal screening, remember that your pregnancy history is also cardiac history. There are certain conditions during pregnancy which are not just events; they are predictors of future cardiac risk. So that could be gestational hypertension, gestational diabetes, preterm birth, PCOS, preeclampsia. These are some of the conditions. If you have experience around your pregnancy, please do share with your cardiologist or with your doctor, because if someone has gone any of these conditions, their risk needs to be seen from a different lens. So in the summary, I would like to say that first, do remember that heart disease is the number one killer when it comes to women, more than all the cancers put together. Second is that South Asian women have higher genetic risk. Third, we covered about the importance of getting right screening and testing done, and also sharing your proper pregnancy history when you're consulting a doctor. Then we spoke about the pillar nutrition, where we spoke about importance of fiber, importance of taking omega-3 and right protein, and the plate method. Please do not forget that. And then we talk about the exercise element, in which the combination of three dimensions are important: the strength training, the aerobic training, and the relaxation training. For relaxation, yoga is a best tool in India. And for strength training, you need to do 2 to 3 times in a week. That is good enough. And the last is the aerobic fitness, for which I shared the interval walking technique. And as I mentioned, you will find details about it in the ebook, which you can get access to. So thanks a lot. I hope you found value in this webinar. And mind you that all the information it has been shared is for not for a medical purpose. Please consult your doctor if you have any medical symptoms, or you want to get proper diagnosis done. This was only for education and information purpose. So thanks a lot, and looking forward. Do check out our social media handles, and visit our website. We also run a newsletter, and we also run a heart health coaching program. You can message us, reach out to us, and we'll help you and share how we are approaching this problem in a more holistic and integrating manner, because if you are not taking care of nutrition, exercise, and yoga, we integrate them and in a manner that gives you the best possible chance, in a manner which you can actually sustain. Thank you. Thanks a lot for your time.